Coming up today, surviving stage 4 stomach cancer. Meet a young dad doing so well he no longer needs treatment. The incredible milestone 7 years after the surprise diagnosis. Good morning, I'm Alexis Del Cid. I'm in for Jessica Lovell. Welcome to the Morning Medical Update. If you ever Google cancer survival rates, read the fine print, or in this case, the American Cancer Society uses bold letters. It says the numbers are estimates based on previous outcomes. They cannot predict what will happen in any particular case. And that is especially true for the man we're catching up with today. Statistically speaking, there was only a 7% chance Austin Hill would survive stage 4 stomach cancer. But statistics don't even come close to telling his whole story. We are so happy to be catching up with Austin Hill this morning. Austin, how are you feeling?
I feel great. This is the best I've felt in, I know it says 7 years, but really 8 years because I wasn't feeling well leading up to the diagnosis.
Oh
so
my gosh.
I'm glad to be here, so thanks for inviting me.
We're really happy you're here. And you also have your son in the control room.
I do.
Who's watching us. You guys have a golf tournament later on today.
Correct.
And we also are joined by two people who have helped get Austin to where he is today. We have Dr. Weijing Sun. Dr. Sun is an international expert focused on GI cancers, translating research happening in the lab into real benefits for patients. At the University of Kansas Cancer Center, he's the division director of medical oncology and the Associate Director for Clinical Research. That's a mouthful. Your business card is jam-packed. And we also have Katie Vernier. She is a clinical nurse coordinator, and Katie works closely with Dr. Sun and his patients like Austin. It is so fantastic to have all three of you here. Before we hear how Austin is doing today, though, we want to take a look back at where Austin was 6 years ago. Here's Jessica Lovell.
I just had a little bit of a stomach ache and went in to see the doctor. They thought it might have been something bacterial.
It wasn't bacterial. When 29-year-old Austin Hill went in for further testing, the news wasn't good.
They diagnosed me with adenoid carcinoma, which is a form of cancer, and they said that they would like me to go see a doctor over at KU.
It was here at the University of Kansas Cancer Center that doctors became aware of Austin's grave condition. When he did not respond to the chemo, doctors told Austin that qualified him to try an immunotherapy regimen.
Instead of killing the cells with chemotherapy, we're actually going to reprogram your immune system to go and attack these cancer cells.
The general population for gastric cancer, we don't find this treatment is super helpful.
Which makes Austin's response to the immunotherapy treatment quite rare.
What caused the cancer? We call it genetic defect or tumor markers. For gastric cancer, stomach cancer, for the MSI population, it's only about 5 to 10% of people have this mutation.
We just tried to find the silver lining.
Austin became a father for the third time shortly before his diagnosis.
When I'm up at the hospital, she slept on the couch, with my wife for many nights. I mean, she was kind of like our team mascot. The surgeons would come in and step over her, and they would all, people would come into the room and just look at the baby, and, it made everyone happier. But the physical pain isn't as challenging as the psychological pain. And that's really the part that you have to get over.
And he's had a few setbacks, including a 50-pound weight loss. And although Austin is told he'll never officially be considered cancer-free, that's not stopping him from living like it. He continues to fight. He's back to his workouts, and most important, coaching his son.
I want my kids to be old enough to know who their dad was. I want to take my son hunting. I want to take my daughters to their first daddy-daughter dance. I want to be there for my wife throughout the rest of our lives.
What a great story. And Austin, I want to make sure we show a more recent photo of your family because we have to acknowledge Miracle Mary. Miracle Mary is your fourth child who was born after we did that video. How old is Mary now?
Mary is 5 and a half. She's just finishing up pre-K. She graduates from the pre-K school in like 2 weeks, which I didn't even know they had pre-K graduation, but I guess they do.
It's graduation for everything
You're
now, right?
Yeah, she starts kindergarten in the fall. So
that is congratulations.
Thank you.
Beautiful family. We just heard in that video that you were told you would never officially be declared cancer-free. So when we talk to you today, what words make sense to you when talking about the status of your cancer?
Yeah, I think one of the terms that I learned just from my conversations with Dr. Sun and Dr. Alkes-Bouls was the no evidence of disease term. And prior to my diagnosis, I think just the relationships that I had and everyone that I knew that had gone through a cancer diagnosis had always been that I think the term was remission. No evidence of disease is probably the best term that I describe my situation, my current situation right now. I try not to say that I'm cured or, you know, there might be times where I say I'm cancer free, but no evidence of disease is probably the best description for it because I think mainly because I think we try to bucket things into either a black or white response. And I think the best way to describe it is for what we know now with the current technology, current screening tools, everything like that, there are no signs of cancer.
Are you able to go through your days not thinking about it? Is there ever a part of you that's always kind of there?
There's always, in the back of my mind, it's always there. And I think a big part of that is because not having a stomach, I feel it. I physically feel it every time I take a drink, every time I eat. So it's hard not to think about it. Now, I think my mind and my thoughts are generally more positive than they were 7 years ago, 6 years ago. But definitely think about it every day.
We're going to get to the whole not having a stomach part of your treatment in a little bit because what you opted to do is really interesting. I want to ask Dr. Sun, medically, what words do you use as his doctor to describe the status?
Yeah, most objectively, you say no evidence of disease, but on the other hand, our immunotherapy trying to clear all those tumor cells, make the body tumor cells free. So technically, he may be cancer-free already, but by today's technology, so most objectively, most scientific precisely, you say no evidence disease. So that's our goal is trying to use the immune system to clear our cells. So cancer-free to the point, I can say probably likely technically, you're cancer cell-free already, but how to prove it, how to objectively. So no evidence is a very important, the true statement, but on the other hand, to vigilant surveillance for make sure Austin doing well, all those years coming, that's important. Because our job, besides the prevention and the surviving and the long-term surveillance is important. So that's why we use the terminology. It's called no evidence disease, even technically could be cancer-free.
So you're just constantly surveilling to make sure there's no evidence.
Exactly.
Which is exactly what's happening, which is great. And Katie, you've been an oncology nurse for 8 years. So in your expertise, how often do you see a stage 4 patient like Austin not just survive, but rebound and have such a full recovery like we see with Austin?
It's incredible. It's honestly incredible. I've been inpatient and outpatient with oncology, and I have yet to see a patient like Austin rebound, especially with how ill he was in the beginning. That was before I was with Dr. Sun, but he was very ill in the beginning, and I do know that. And it's incredible. It's incredible. I was telling him this morning that I lost my grandfather to stage 4 gastric cancer, and that was 23 years ago. And so Austin is really a testament to how far we've come in science and medicine, and hopefully we can continue to treat patients like Austin and make more patients no evidence of disease with stage 4 cancer.
I'm sure the research is growing in leaps and bounds. And Austin, we asked Dr. Jeff Hollesbrine, the physician-in-chief of the Cancer Center, about your case. So take a listen.
I think Austin's a great example of how far we've come in cancer treatment. You know, I think 10 years ago, certainly 15, 20 years ago, he would not be alive today. And we certainly wouldn't have the options of potentially curing somebody or, you know, significantly extending their life. So it really does demonstrate, I think, the significant advances in cancer treatment that we've had. The other thing that I love about Austin's story is the multidisciplinary care that he received and how critical that is. We talk a lot about that here at KU and how important that is. But he's a really great example. And so, you know, not only was he seeing disease-specific medical oncologists who knew about the latest treatments for his disease, but he also had a great surgical team. And that surgical team provided treatments for Austin that really aren't done anywhere else.
We want to talk about your surgery. You mentioned off the top of the program that you don't have a stomach. Austin, there was a crucial fork in the road where you had to decide on a treatment path. You took a bit of a leap, and you chose one of the most aggressive surgeries out there. You had your stomach removed, along with the lining of your abdomen, at least the parts where there were cancer, and then they filled your abdomen with a heated chemo drug, and that's what we're seeing in this video, is someone pushing chemo around inside the belly, and that's something called HIPEC, which is not commonly offered. It's done by Dr. Mazen Al-Kaspouls here at the KU Cancer Center. HIPEC, we know, is very harsh on the body, and there were some very rough days as you recovered. What made simple things like going for a walk or even taking a shower such a challenge?
Well, I think the obvious one is just being stapled for about a 14-inch incision. I think that's challenging for anyone. But then I also, in addition to that, had a J-tube in coming off of the side, which is where I got all my nutrition from during that recovery period.
And was the J-tube, how does that work when you're home? Was it at home you had that tube?
Yeah, it was at home, so I would just have to hook up the, what do you call it? It's almost like the equivalent of a protein shake or some kind of fluid that goes into that tube, and then you just have to make sure that you clean it and maintain it so that it doesn't get pulled out or anything like that, which you can imagine that's difficult with 4 little kids, making sure that no one pulls on Daddy's J-tube. So
they're pulling on everything.
Yeah, and it was pulled on it at one point on accident. So, but I think to answer your question, some of the things that made it difficult, I think just tying my shoes. I mean, just having to, Andrea was great. Andrea's my wife. She's a nurse by trade. And
Lucky you.
Yeah, I know. I was very fortunate to have her there. So she had this chart up on the wall of how many times I was supposed to get up out of my chair and how many times I was supposed to go walk around the cul-de-sac that we lived in. And I think just, there were times where I had to say, oh yeah, I walked the full circle, and maybe I just tied my shoes and sat there and waited for her to get back. Yeah, but I think just the overall muscle pain, I think just trying to do general pain control was a challenge.
Well, and how many little kids did you have at home at that time?
I had 4.
And everybody's in pain when they have 4 little kids at home.
Right.
Without everything you endured. Did you ever forget and you lean down to scoop one up, and then you think, oh my gosh, I can't?
That was never really an issue at that time, and in fact, I know we'll get into this later too, but I think it was so challenging. I had to detach from a lot, just mentally, physically, just to focus on myself during that time period where during the roughest moments of my physical recovery, I really wasn't interacting with the kids that much, which made it difficult.
You're such a present dad. That's obvious when you walked into the studio right away, is how present you are, so that must have been really hard emotionally. What did the surgery change about how your abs work?
Yeah, I think, well, initially it was just being able to stand up straight. So the PT involved in it, I remember them telling me to pull your shoulders back, pull your chin back, and so I would exaggerate it just to kind of get a laugh out of people where I just like walk around like a turkey. But yeah, it was just trying to get my muscles to compensate for what I was losing in the front, which you can imagine if you're cut open in the middle, you're hunched over. So, so it took a lot of PT, it took a lot of learning how to walk again, get up the stairs, and strengthening exercises.
We were watching the videos that you have of you working out, and you're doing these incredible exercises. How quickly were you able to go from everything you endured back to workout shape doing this?
Let's see, I had the surgery in March of 2020. I ordered an elliptical machine. It was actually a rowing machine that I could put in my living room. It was low impact. I didn't have to use my abdominal muscles very much, but just to get some kind of movement. So I just would try to do 5 minutes at a time and then move that up to 10, then 15. Eventually try to do a push-up. So, and it was not without pain. Everything I did was painful, but I tried to push it just a little bit further.
We've talked to a few people on this program about life without a stomach. They've said it's actually not that bad once you adapt. So how have you adapted to not having a stomach?
Well, I think a lot of it's trial and error, because the information that you get from the dietitian, it's all just generally speaking, these are the foods that you can't eat, or generally speaking, this is the activity that you should probably try to avoid. And it might have been just the arrogance that I had, where I'm like, well, that's most people, but that's not me. So I think at one time Bethany was our dietitian, and my wife had texted her a photo of me eating corn on the cob, which is not something you're supposed to do without a stomach. So,
Right.
but I've always tried to push the limits, and I found out what sits well with me, what doesn't sit well. And then also just with my background in exercise science, trying to figure out, okay, if I'm going to gain weight again, and if I'm going to get strong again, I need to be getting calories. How do I do that? So it's finding out what high calorie items can I eat that I can digest and feel comfortable with, and you know, continuing to, again, just like the physical part of getting stronger, the nutritional part is just testing out my theories and finding out how far can I push this. And I did push it too far a few times, and it's painful. It's a good lesson to learn, but that's the only way that I could figure out what I could eat and what I couldn't eat.
When it comes to immunotherapy, which has been a huge part of your treatment, up until very recently, you were getting infusions of the drug Keytruda. Do you have any idea, roughly, of how many infusions you've had over the years?
Dr. Sun and I were talking about that before the show started, and I lost track because we went from like infusions every 3 weeks to then infusions every 6 weeks. But if I had to put a number on it, it would be over 50 at this point.
Wow. And Dr. Sun, you mentioned that immunotherapy is an option, but most patients don't respond as well as Austin did. So what made Austin's cancer so special, and why does that allow immunotherapy to work well for him?
Yeah, so Austin has a special mutation called the MSI, or called MMRD, which is called a mismatch repair gene was deficient. So the body naturally have an immune system trying to attack the foreign body, such as the bacteria, virus. So when the cancer form, on one way, body trying to build up an immune system against it. However, our cancer is our own cells went wrong. The immune system balance part consider, well, that's our own cells, don't do it. So that you have a two system. One trying to attack the cancer, the other say, don't go crazy because of your own cells. So this immuno-checkpoint inhibitor, like we use today, Keytruda, so they suppressed the suppressing cells. So make our own cells, T cells, supposed to attack the cancer to be active. So that way, it can overcome those the tumor-related issues. That's very effective for our own body to do it. But for those kind of mutation we only identify probably 5%-ish for gastric cancer. So that's very important for we diagnose the patient to find those mutations. There are other mutations we can take differently.
What enabled him to stop taking Keytruda then?
So the question are a couple of things. When immune system really works, so they get attack the cancer cells clean out. There's different as a chemotherapy. You know, your cells could be cleared out, completed already, but scientific today, we have no clear idea how to assess the situation right now. So most of the scientific data suggests now is about a 2 to 3 years treatment. Likely or is enough to do that because you don't want to over pushing the immune system to the other end. So for this reason, and his treatment right now is hold it, and we don't need, hopefully we don't need it anymore. However, on the other hand, as I said, vigilant surveillance is important just to make sure every step there is no other situation come back.
Does stopping the treatment then, could it raise the risk of the cancer returning?
If the immunotherapy works very well, scientifically, they could completely wipe the tumor cells up technically. However, the surveillance is important because our current technology has no 100% way to know who is the patient and where the situation completely clear out.
When you learned, Austin, that you could stop the infusions, how did you feel?
Well, we feel very good because, you know, as a physician, we always tell patients that what the patient family or patient wants is what we want. That's a tremendous awarding for us, for we can take care of patients like us in these kind of cases. You know, so it's more than any word. You know, the reward is just amazing. You know, so make our job. It's just like, you know, it's tremendous award, you know, that's out of question.
Well, I think it was back in November, too, when all this came to be, which was roughly 6 months ago now. So I know when I came into my regular office appointment, I was ready to get an infusion. I think I'd even been hooked up with an IV ready for the infusion. And Dr. Sun came into the office and he's like, we're all done.
Oh,
we don't have
wow.
to do this anymore. And I think in the midst of my tears coming down my face, I give him a big hug. And it really was kind of full circle the way it all began, where I was receiving the news from KU. I received a call that said, hey, your cancer test came back, it's positive for cancer. I was working at Children's Mercy at the time, and I was in my truck in the parking garage by myself, just trying to process all the emotions. And after I left the clinic, I was in a parking garage at the KU Cancer Center in my truck by myself, and totally different range of emotions, but just kind of feeling like, oh my gosh, I did it. Like, this is it. I can't believe I'm done. And it was a weird feeling walking out of the cancer center after meeting all the people that I had met over the past 7-8 years, and just wondering, you know, I don't know how often I'll get to see Dr. Sun or Katie again, but then also thinking about all the relationships that I made with people who I met there and never saw again because maybe they didn't have the outcomes that I did. So lots of emotions to process, both good and some that are a little more difficult to deal with, but overall feeling very grateful about it.
It sounds surreal, what you're describing. It's like you're coming out of a dream,
Right.
a 7-year or 8-year dream.
More of a nightmare.
Nightmare,
yeah.
exactly. Yeah, a fever dream.
Yeah.
Katie, how often does someone with stage 4 cancer, stage 4 stomach cancer, stop treatment because they're doing so well?
It's not common. It's not common. Typically, our stage 4 patients are on treatment for life. And, you know, I think it's also important that we mention that Austin was on immunotherapy for a few years when his insurance was like, you don't have any evidence of disease in your body. I think it's, you know, reasonable if we stop these treatments. And it's not often that we agree with insurance companies, I will tell you that.
Right.
But in this case, we did agree because, you know, Austin's been without evidence of disease in his body for so long. It's perfectly reasonable that we stopped those treatments. It's amazing.
We have questions coming in and comments, and we have more questions coming up about mental health and your new foundation, Austin, which is remarkable. If you have a question or a comment that you'd like us to read out loud during the program, share it with us here live. Please take advantage of the chat on YouTube, Facebook, or you can email the Medical News Network. You can connect with us right now in real time, and all that information is right there on your screen. About mental health, Austin, you wrote in a blog post something pretty powerful. You wrote about invisible wounds that need healing. What would be an example of an invisible wound?
Well, I think I go back to having to detach from a lot of things. And it's not because I wanted to, it's because that's what I absolutely needed to do to really mentally refocus myself. And I think a lot of mental health and a lot of getting through something like a cancer diagnosis, it's no different from any other hardship where hopefully all the preparation and discipline that you've had in your life leading up to that prepares you for that moment. And I think that that's exactly where I was at when I was diagnosed. I was healthy. In my mind, I was healthy aside from the cancer. Physically, I was strong. Mentally, I was strong. I'd actually read a book, Man's Search for Meaning by Viktor Frankl, twice before my diagnosis and then once after my diagnosis, which it's a philosophy book, which is my favorite category of books to read. But I think just mentally preparing for that situation and realizing that there's so much that's out of my control. How do I control what's in my control in a situation that seems so dire and so far out of reach that nobody really that I knew had ever achieved? I think the mental health part is challenging. And when I talk about the invisible wounds, an example is when you're laying there in your chair at home or in the hospital bed, and you have your community of friends and your family around you and your kids, and you see how much of a burden you are on them, or at least you perceive yourself to be a burden, because people are sad because of your diagnosis. People are working extra hard and trying to take over your responsibilities that you should have in the household because you're sick. You start to think, man, maybe I'm more of a burden being here than if I was to just not have a favorable outcome. And so all these, and that's the devil just playing with your head the whole time. The devil tries to make you doubt everything, and that's where I really had to rely on my faith and my family and my community of friends. And I would highly encourage everyone to really lean on those people that are there to support you, to get you through those tough times.
That's such a vivid description. And I'm sure there are a lot of people watching who are going through something that can relate to that, but you put it in words so beautifully. Cancer has obviously shaped your life, but you also want to make it clear that cancer doesn't define your life. Why is that important to you, and how do you do that?
Yeah, I've said since the beginning, I don't want to be introduced as, oh, that's the guy with cancer, or that's the guy, you know. Now I don't mind being introduced as that's the guy that beat cancer, because that's quite a feat. But I have a lot of other things that define who I am. I'm not defined by my career, or I'm not defined by what's happened to me from a cancer diagnosis, but I would much rather be defined as a good dad, a good husband, and those are the things that I really strive for. And I really feel like in all of this, the big message is that you try to find the reason and the meaning behind all the suffering. You start to ask yourself, why me? And I think the big takeaway that I always wanted to leave this situation with was, how did I turn such a bad thing into something good? And that's where, you know, we created the foundation. So,
which brings us to something we want to talk about actually right now, is your foundation. And you started to help families who are in the same position as yours. Yours is a very unique foundation. It's called Mission 212, and there is something that sets it apart from other cancer foundations.
Yeah, so, and this is based off of my own experience that we started this foundation, but really there were a lot of resources out there, but one of the challenges for my situation in particular was, in the Cancer Resource Center, they have flyers all over the place, brochures for all the different types of cancer. There were no resources for gastric cancer, surprisingly, because it's in relation to the other cancers, it's not very common. Another resource that I didn't see was anything about fatherhood and how to get through things as a dad. But there were resources for moms. And so when I sat back and looked at this, I'm like, you know what? There's a lot of great organizations that support breast cancer, colon cancer, that kind of thing, and even stomach cancer, but we specifically tailored ours to support fathers and their families that are diagnosed with cancer. And they have to qualify for assistance, they have to have dependents in the home. But we've served 10 families up to this point. I think we started the whole thing with the idea that we would serve one family in a big way each year. We've been around for just about 3 years, and we're up to 10 families at this point. And the interactions and the relationships that we've built with these families have been incredible. We try to do everything from medically related financial issues to more of a Make-A-Wish type of situation, where we try to send people on trips where I specifically designate that money to tell them, you know what, go on a trip with your family, don't feel guilty about the support that you've received. We want you to go make memories with your young kids.
That is so great, because I've heard other survivors talk about the guilt they feel about doing something nice with their family, because they feel like everything needs to go to their medical bills. But part of the recovery and the survival is putting joy in your life.
Right. It's always having something to look forward to, and that's not just in a situation where you have cancer. That's how you should be living your life anyway. You should always have something to look forward to, and what better way to support these families than to make good memories with the people that they love the most? And really, for these young kids, I want these kids to remember their time where their dad was sick, that it wasn't just spent in the hospital, that they were still doing the things that kids get to do with their family. They get to share laughs, they get to share memories, they get to go to places. So, another family that we helped, it was their anniversary coming up, and they felt like they couldn't take an anniversary trip because of all the financial support they've received. They felt bad about taking that trip and spending the money that everyone gave them on that trip. So we supported them and said, you know what, this money is for you to go take your anniversary trip. They took their kids, and it was a great time for them.
What a gift. Katie, when we talk big picture, how is immunotherapy changing oncology?
I think it's giving patients like Austin, more treatment options. It's not just, this is one chemotherapy, you're going to get this, and hopefully that works. But for Austin's case, it truly saved his life. So I'm hoping that, as science evolves, we'll be able to help more patients like Austin.
And Dr. Sun, what would you say?
Yeah, and also because the University of Cancer, so we're doing clinical research all the time. And we did a pioneer study actually based on the information from Austin's case. We gave a patient a potential surgical resectable patient because one of the reasons esophageal cancer, gastric cancer, even you go to surgery, the disease come back sometimes. So we did a study is a chemotherapy plus immunotherapy, gave the patient before surgery and after surgery and a long time immunotherapy. And we did this pioneer study, very successful. And probably next month, and the national, we're going to publish some data about this based on those information to be largest study, turned to be about immunotherapy plus chemo for those patients. Potential surgery could be standard of care for their for before and after surgery.
We have some great questions and comments coming in, so let's get straight to them from our viewers right now. Diane T. wanted us to share, this is very helpful information. It seems more cancer patients are talking about receiving immunotherapy, and she goes on to ask, will we get to a day when patients receive immunotherapy instead of chemo?
It depends on the mutation. Just for Austin's case, after later on, we don't need a chemotherapy, gave it to him. And after surgery done, because that immunotherapy is good enough to clear the tumor cells. But some patients, you have to combine the chemo and the immunotherapy together. Some people immunotherapy may not do the job. That's why you check the mutation, what the patient have, what called a precision medicine or individualized medicine or personal medicine is fine. The whole idea is what the cancer characteristics of those mutations are important to guiding your treatment.
Yen Liang has an interesting question. He writes, immune checkpoint therapy enables our T cells to precisely target and attack cancer cells. My question is it possible for our T cells to become overactivated to the point where they also attack our own healthy cells, compromising the intended precision of the treatment?
The answer is potential possible, but we do have those kind of patients have some autoimmune-like the symptoms, and we have to watching patient on the immunotherapy very carefully. So immunotherapy itself is not risk-free. So that's why the physician and the nurse and the team and work together to watching those potential possible events.
Jeremy Yenser has a question, and I think a lot of people are wondering this, hearing your story. Jeremy wants to know, how do you detect when something this severe is happening in your stomach without it getting too far? It seems like a lot of symptoms would be easy to write off, like normal stomach weirdness.
That's exactly right. That's why stomach cancer a lot of times isn't found until later stages, because it doesn't present concerning symptoms. I think before my cancer diagnosis, the stage 4 diagnosis was in February of 2018. I didn't even feel a single symptom until probably August or September. And that was, and just being generally being a healthy person and feeling a little discomfort in my abdomen, I didn't think anything of it. You really start to think, and after multiple trips to the ER, not the KU's ER, a different ER,
right,
and being told that, oh, it's irritable bowel syndrome, or you just ate something, go home. And I was sent home from the ED 3 different times, dismissing any symptoms that I had. Now, they also did scans, and they found that there was nothing showing up in scans. So,
was there anything that could have been done to detect that earlier?
So the question, yes or no, the number one, some symptoms, are not 100% reliable because there is no called specific cancer symptoms until later stage.
Oh.
So those early symptoms could be very common for other things, reflux, you said gastritis, or food poisoning can all have a similar. However, both patient, or we should call patient, need to be precautious if something doesn't make sense. We are long-term relatively, so need to get more medical attention. At the same token, physicians should be also precautious of sometimes something doesn't make a common sense. You get acting early upon. The other yes part is if we acting early, we might find a disease early, such as colonoscopy, endoscopy. Those are technologies there. So take the patient and the physician both pretty cautious to do the work, the answer is there, but common things is common. Sometimes it could be, that's how to say that, really patient and family, doctor, everybody should be precautious for those. Doesn't make sense sometimes.
Thank goodness you finally wound up here. Thank goodness for that. For today's takeaways, I would love to ask each of you, what do you want people to know, Katie, who are watching this?
I think that this whole story is a testament to three things. I think Austin is incredibly strong. He fought very hard. It's also a testament, to the advancements in science and technology and chemotherapy, clinical trials that developed this treatment for patients like Austin. And third, it's physicians like Dr. Sun and Dr. Alkaspouls who make those treatments happen, who develop those clinical trials. So it's really a testament to all three of those things.
Dr. Sun, would you like to add anything?
Yeah, 100% agree with Katie. It's she summarized it very well. So really is you need know yourself, and the physician and the nurse takes a village to do best thing. And the good thing is if you look at the statistics numbers, every year now have more and more patients got cured, have more and more patient died at the relatively early stage. Because science evolution is very, very important. That make us to be, very rewarding. And our job is push the science to move forward, and we can treat more patients like us, Austin's outcome. That's our job. We're proud to work at a university hospital like a KU.
Oh, we're pretty proud to have you, all of you here. Austin, what would be the message you'd like to share for our viewers?
I've shared this message so many times, and I know the people that I work with and even the people that I live with are probably tired of hearing it, but I really truly believe that a big reason and a big factor in my healing and ability to get through this whole cancer diagnosis has been controlling what I can control and being able to take a step back. And even with the diagnosis originally, when we didn't know what it was, but through all the initial testing, that was the most anxiety-provoking of the whole situation. It's not knowing. But once I found out it was cancer, I think my answer was, great, now what do we do about it? Like, at least we know now. So I've taken that approach in almost every aspect of my life and my career, at home. I preach it to my kids. If we're upset about something or anxious about something or even depressed about something, it's what can you control about this? Is there something you can do? If not, don't worry about it. If there is something you can do, great, there's options and you can control it. So I would just emphasize that with any aspect or situation that you're in your life right now, is to just focus on the things that you can control.
Such a good message, and something that everybody can remember as they walk through life, whatever heads their way. Thank you, Austin and Katie and Dr. Sun. We really appreciate you all taking the time to join us. And thank you to our viewers for being with us here today and joining the conversation. We will see you right back here on Monday morning. Coming up Monday on the Morning Medical Update.
Before, with my back and with my pain, there's no way I would have been able to take my kids to the park and run around with them.
Chronic pain was robbing a young mom of special moments. I'm Alexis Del Cid. On the next Morning Medical Update, the tiny implant bringing real relief after years of pills only muted the pain. See how spinal cord stimulators can change the pain before it reaches the brain. Monday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stein's podcast. Now everywhere podcasts are available.